Good morning. I'm Anne-Marie Lang-Berkowitz, Executive Director of the North Peel Family Health Team. Before we begin, I'd like to acknowledge that Brampton sits on the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. These lands are part of the Treaty Lands and territory of the Mississaugas of the Credit. I'm grateful to live, work, and gather here, and I honor Indigenous peoples today and every day. At North Peel Family Health Team, we're committed to delivering comprehensive, accessible care to the Brampton community. That starts with a dedicated interdisciplinary team, professionals with the right skills providing care at the right time. We're proud to be a healthcare system that's evolving to meet the needs of our diverse and growing population. Earlier this year, through the Government of Ontario's call for proposals to expand primary care teams, we received over $1.1 million to help connect up to 2,525 more people to care. That's leadership in action. It's now my honor to introduce someone who has been instrumental in strengthening Ontario's healthcare system. The Honourable Sylvia Jones, Deputy Premier and Minister of Health, has shown a deep commitment to expanding access to timely, effective, and compassionate care across the province. Please join me in welcoming Minister Sylvia Jones.
Thank you, Anne-Marie, and good morning, everyone. It's always a pleasure to be in Brampton, and of course, today I'm joined by Dr. Jane Philpott, who is the chair of our government's Primary Care Action Team, as well as local MPPs, Prabmeet Singh Zakaria, Charmaine Williams, and Graham McGregor, who have been incredible champions for the healthcare needs of Brampton families. Thank you to Anne-Marie and everyone here at North Peel Family Health Team for hosting us this morning, and for everything you do to provide patient-centered care each and every day. Under the leadership of Premier Ford, our government has been making record investments to protect our healthcare system. We continue to make significant progress through bold and innovative actions to make it easier for patients and their families to connect to care closer to home. Here in Brampton, we are building William Osler Health System's new state-of-the-art Peel Memorial Hospital. And this year, our government increased operating funding to William Osler by over $18 million so they can better meet the needs of our growing communities. Our government has also continued to grow and strengthen Ontario's highly skilled healthcare workforce, adding nearly 20,000 additional physicians since 2018, with an over 14% increase in family physicians. And we have recently made it easier for U.S. licensed nurses and board-certified physicians to move and practice in Ontario. So far this year, nearly 1,400 nurses and more than 260 doctors have already chosen Ontario as their place to practice. We are also transforming frontline healthcare in our communities through our government's Primary Care Action Plan, supported by our historic investment of $2.1 billion. And today, we are here today to announce that we are launching our next call for proposals to create and expand approximately 75 primary care teams through a $250 million investment that will connect 500,000 more people to a primary care clinician. This brings us another step closer to connecting everyone in Ontario to a primary care clinician by 2029. In June, you may remember we announced a $235 million investment, which funded more than 130 new and expanded primary care teams to connect more than 300,000 people to primary care. And many of these teams are already accepting new patients. This, of course, includes supporting the North Peel Family Health Team through an investment of more than $1.1 million to attach up to 2,500, and did I get that right, Anne-Marie? Yep, 25 patients to primary care, one of several local teams who have received funding. And last year, we invested $110 million in primary care teams to help to connect almost 370,000 more people to primary care in their communities. I am thrilled to share that the Healthcare Connect waitlist has already decreased by more than 98,000 people, over 42%.
Wow.
Our plan is working. Ontario continues to lead Canada with our unprecedented investments and rapid actions to strengthen the healthcare system. Through our plan to add over 300 new primary care teams across Ontario, connecting 2 million more people to publicly funded primary care by 2029. And the recently passed Primary Care Act establishes primary care as the foundation of Ontario's healthcare system and sets out 6 clear objectives for Ontario's publicly funded primary care system. Those are province-wide, connected, convenient, inclusive, empowered, and responsive, to ensure people know what they can expect when connecting to primary care, and that we have a primary care system built for decades to come. Thank you again to the North Peel Family Health Team and all the healthcare workers and primary care leaders and organizations in Brampton and across our region who provide world-class care to patients and families in their community. It's now my pleasure to invite MPP Prabmeet Singh Sakaria to share a few words. Thank you. Stay well.
Thank you, Minister Jones, and great to be here. And what great news for Ontario communities, and a special story right here in the city of Brampton. It's a pleasure to be here, and thank you to the North Peel Family Health Team for hosting us and for everything you do to provide exceptional care across the city of Brampton. I'm also delighted to be here alongside my colleagues, Minister Jones, who you heard from, and my Brampton colleagues, MPP Williams and MPP McGregor as well. Today's exciting announcement is one more way our government is continuing to build on our progress to connect everyone in Brampton and across Ontario to publicly funded primary care by 2029. Our last call for proposals in the spring saw several primary care teams right here in Brampton receiving funding to connect over 20,000 people to primary care in our community. And through a previously announced investment, our government is providing primary care teams with $142 million in operational funding over 3 years to recruit and retain healthcare workers. Funding can be used for non-physician team members, such as nurse practitioners, registered nurses, physician assistants, and pharmacists. Our investment in primary care is one more way we are growing our province's highly skilled workforce and ensuring people and families have access to high-quality care closer to home for generations to come. Thank you again to the North Peel Family Health Team and all the healthcare workers and organizations in Peel who provide tremendous care to patients and families and contribute so much to the health of our communities. Now it's my pleasure to invite MPP Charmaine Williams to say a few words. Thank you.
Hi, everyone. You know, I've seen firsthand the positive impact that today's announcement will have on communities across Ontario. Right here in Brampton, several outstanding teams are receiving fundings through the last call for proposals, and I'm thrilled to see some of the recipients here today for this announcement. I want to extend my heartfelt congratulations to those recipients. North Peel Family Health Team, Wellfort Community Health Services, and Queen Square Family Health Team. Congratulations. Your work is proof of what is possible when we put people first and build strong partnerships. Investments like this not only strengthen our healthcare system, but also empower frontline workers and community partners who dedicate themselves every day to improving health outcomes across our province. It is your passion, your innovation, and your pursuit of better care that makes initiatives like this so essential to the future of healthcare in Ontario. And I just need to say a special thank you to Minister Jones for your commitment to this healthcare system and everyone in here. And of course, the next person I'm going to invite to the podium, Dr. Jane Philpott. the chair of our government's primary care action team, to say a few words. Thank you so much for all that you've done to help us rebuild our healthcare system. Thank you.
Thank you, MPP Williams, and good morning, everyone. It's wonderful to be here at the North Peel Family Health Team. With the support of the Ontario government, teams like the North Peel Family Health Team are expanding access to care, bringing more services closer to home for people across the province. These teams are the front door to our health system. They are led by family doctors or nurse practitioners, and they provide timely, comprehensive care that makes a real difference. Over the next year, even more people will be connected to care through these teams. So today we are building on that momentum. We are officially launching the next call for proposals that will attach 500,000 more Ontarians to primary care. Communities across the province will be eligible to apply, and Ontario health teams and their primary care networks will play a critical role in working with local primary care clinicians and organizations to submit proposals. The successful teams will be announced in the spring of 2026, and there will be more opportunities to apply in future rounds. I want to thank in particular today the incredible work of clinicians and teams who are, as Minister Jones said, attaching patients through Healthcare Connect. Through their dedication to this, the Healthcare Connect waitlist that stood at January 1st, 2025, it has been reduced now by over 42%. I'm thankful to the leadership of Minister Jones and the entire Ontario government. We are making real progress. We are attaching more people to primary care and strengthening our primary care system. Together, we are building a system that is truly comprehensive, convenient, and connected, and one that will serve every person in Ontario. And of course, I can't leave out thanking the incredible frontline workers, the family doctors, nurse practitioners, and all allied health professionals who are the heart of our healthcare system. Your compassion and commitment make all of this possible. Thank you very much. Merci beaucoup.
Should I go?
We will now begin to take questions from the media. So all media present, please stay in this area. I will help prop up the microphone for you. And as a reminder, it is one question, one follow-up. Thank you.
And I'm hoping I can get a bonus cue because it's for a colleague. So my first question is this report that came out recently about people leaving the ER. It was almost 300,000 people in Ontario last year. What are you going to do about that?
So we've actually been doing a lot of work with our Ontario hospital colleagues and the leadership to find the best practices. There are definitely some real shining lights in certain hospitals that have done some innovation that make sure that people know and understand why there is a wait, so the triaging process, and have done some innovative things like saying you can actually go home and come back at a certain time frame because that's when we will be ready to see you. So there's a lot of innovation that's happening. We have more news to come in about a month or so where we will put more detail on it, but I want to reinforce that our emergency departments are very much modeled and work on a triage system. So the sicker that you are, the faster that you get seen by a clinician. And we want to take those best practices that are happening in hospitals across Ontario and scope and scale it so that everybody has those same opportunities.
Did you have anything to add, Dr. Philpott? Just thought you might just as an extra. There's a story that came out in the Toronto Star just in the last couple days, and it was about this family doctor who's from the States, been practicing in Toronto for a couple of years now, but he can't get his permanent residence. And so it made me think about I don't know if this is happening with more family doctors. I imagine that this is a broader issue at a time when you want more family doctors. So I'm not sure if this is something that the province would be pushing the federal government on, or if you have any thoughts on that.
Yeah, so it's interesting because anecdotally, we have been dealing with individual physicians from not just the US, the UK comes to mind, where as we in Ontario, through our licensing system, speed up access and licensures. So the College of Physicians and Surgeons of Ontario, we now have physicians who can get their license in under 10 days. And of course, that puts that additional pressure now on the federal government because they need the next step in their permanent resident piece. So I have spoken to now 3 federal health ministers about this issue. It's a bit of jurisdictional piece. So is it actually the Minister of Health? Is it the federal immigration minister? Frankly, I don't care. I just need it fixed. And so as we move forward to make sure that people who wish to practice and live in Ontario and Canada have that opportunity, we're doing it with the licensing, and I now need the federal government to expedite those same applications.
Okay. And then this one is for a colleague who's covering the vaccine rollout, asking why it seems to be so pharmacy-focused, why it appears there aren't very many public health clinics or options like RSV clinics and daycares, when there have been studies that show, people go to get their vaccines where they are, kind of thing.
Well, respectfully, it is available in many different models. All of our public health units are actively involved in making sure that, for example, seniors who live in congregate settings, the local public health units are doing that rollout. We obviously are proud of the fact that we've been able to continue and embed pharmacies as another convenient model, but 100% family clinicians, nurse practitioners, even as we are expanding scope of practice, we're ensuring that, for example, nurse practitioners have the ability to do vaccine rollouts and education. So I would say we're actually expanding it system-wide. We are not focusing on only, specifically as it relates to why not the clinic format that we had during the pandemic, because we have all of those other systems in place now. We have a very robust system in the province of Ontario to ensure that not only people have access, but can have those conversations with their primary care clinicians to say, is this the time, and what should I be looking at in terms of vaccines, whether that's for COVID, for flu, for RSV.
Hi, my name is Mohammed. I'm from The Pointer. So my question is regarding Beale Memorial Expansion Project. Can you please update us where the project is standing at this point? And when the request for proposal was closed in April, who is the successful bidder in that progress? And what is the construction timeline when the Brampton residents will going to see the full construction project?
So as we go through the work with the hospital, we ensure stages. And what you're talking about is that interest, that who out there is interested in actually doing the build. Now there will be a bidding process, a request for a proposal, and upon successful completion and choosing, the hospital will then announce who is the successful bidder. We, as the province of Ontario, obviously have budgeted and are prepared to fund, as we do with all hospital capital builds, 90% of the build, but we do not release that number until we have the final bids coming in, assessed, and ultimately chosen.
So in 2025 budget, there was no specific mention of the specific budget for Peel Memorial. Can you please update us what is the exact numbers for that?
Well, that's what I mentioned. We do not release a number because it would actually influence the bidding process if individuals who were bidding on a project knew exactly how much money the Government of Ontario had set aside. I have full confidence, and I am sure that I would never be invited back to Brampton or to speak to any of my colleagues if we did not set aside that money. It is there. It is. We are absolutely committed to ensuring that this hospital is built.
Thank you. That concludes our media availability. Thank you, everyone, for attending.
Can I get a group shot of this?